In today's presentation, I will lead you through the next steps that the Netherlands is undertaking to implement the European electronic health record exchange format. And since that's such a tongue twister, I will just call it the exchange format throughout this presentation because that's a bit easier in talking. I will approach this topic from current policies and regulations that are either here or upcoming in the Netherlands, and then touching upon the opportunities and challenges that brings for us. So thank you very much for also this opportunity to do so. First of all, I think it's important to mention a bit of our related activities that we also perform as NICTIZ, as the National Competence Center. I will not go into deeply all these activities, but it's important to know that we are connecting the international and European developments with the national developments and actively communicating to that to our healthcare field about that. So we organize webinars, we organize events on this to inform our CMIOs and the healthcare field on the importance of international and European developments for national developments. And we do so, but also our Ministry of Health does this. And it was already mentioned before, because eHealth is an important project in that sense of the last 2 years. What I mainly wanted to talk about as part of the regulations that are taking part of the Netherlands is called the DGIS in Dutch, which is our law on electronic healthcare exchange in healthcare. This is a law that was in preparation for a while, and about a month ago, this has been unanimously voted by our second chamber as a go. So we expect that this will very quickly be a national law, and that's very important in relation to the developments on the EHDS and the exchange format as well. Another main aspect of the Netherlands is a policy that's also about a month ago has gotten into effect. It's the Integral Healthcare Agreement, and there digital plays a prominent role. And these two elements are important because it creates momentum in our country for the developments also on European level. I think everyone sees that this is important, that this is the time to make steps on this. And it also creates the funds for hospitals to do so. So the DGIS law contributes first of all to less errors. In some researches, we see that nurses have to type some elements 9 times to get it right into the record. And 64% of them indicate that they miss information. So by having this law, it contributes to having less errors on that, but also the decrease of avoidable admissions, easing administration, and all that contributes to having more job satisfaction, also paying off investments that are made now in order to make this happen, which in the end relate to better healthcare. And I think it's important to tell you a bit more about what does the law consist of. So what does and doesn't it mean? So it covers 3 main aspects. First of all, that the data is exchanged. Secondly, how it is exchanged, and that the data exchange takes place electronically in a standardized manner. How it is exchanged is related to the semantics and technology. And the third aspect is related to certification. What it doesn't cover is which data is exchanged and which requirements apply for that. It also doesn't cover if information can be exchanged. So that's access and permission. That is covered in a different law than the WEGIS. So that is regulated, but not by the WEGIS law. And the exchange with patients. That's partly done by an amendment, but this law mainly focuses on exchanges between healthcare providers and hospitals. And these developments are important because they are somewhat in our country a front runner of the EHDS and the exchange format. So for example, for the WEGIS law, the digital prescription needs to be implemented in 2023, so next year. The availability of images needs to be implemented the year after, so 2024. And our basic healthcare data set in 2025. So before implementing the exchange format by the EHDS, our country already has by national law things to implement that are on the similar use cases. The agreements on those exchanges are based via clinical information models, and this provides us with some benefits and challenges as well. We see the benefit that this creates momentum and urgency, and that it creates the opportunity for hospitals to get this exchange in place. We also see that there is overlap between our use cases and the use cases of the exchange format, and also the functional and technical requirements there. But the challenges is the aspects that are not having that overlap, and also how to then implement that in the systems. So for example, now we have vendors asking, do we wait for the exchange format from the EHDS, or do we start with the requirements for the WEGIS law, and how does that relate to each other? For that reason, we are performing a fit gap analysis on the prioritized use cases of both the WEGIS law and the EHDS in the exchange format. So we are looking into what is the overlap, what is the gap, and what risks do those gaps take, and how can we cover those aspects. This is also possible since the WEGIS law doesn't say, as I said earlier, exactly which data needs to be exchanged, only how it needs to be exchanged and that it needs to be exchanged. So we can make agreements on which data can be exchanged and make that more in line with the exchange format. An example of where we already performed that alignment is on medical images. As NICTIZ, we were part of the Quas-EHealth project and also task lead of creating the functional specifications of medical images. So there we had a close line with the people working on the WEGIS, and also asked Dutch radiologists on what would you like to have in the exchange format on a European side that was related to having a timeline of images. And vice versa, we said, well, in the European aspects, a structured report is there. Maybe that can be helpful for the functional specifications of the Dutch aspects. So that is brought into line with each other. I think the previous aspects show that we have a fragmented field, so we don't have a green field situation. In the Netherlands, we have also a decentralized infrastructure, so efforts go into reaching agreement and consensus on those clinical information models, but also how to implement those models and thereby the exchange format in the systems of the hospitals. And we address that a lot in the policy that I mentioned, and part of that policy is to create a national vision and strategy that hospitals can use as part of their own strategies. So that's a big part as well of our efforts. Part of that vision and strategy are to have the use of open systems and the use of APIs. There's lots of focus on semantics, also to align that for primary use and secondary use, to create an infrastructure that facilitates data availability, and there's a focus on more generic functions. Thank you a lot for your time.